So as we get older, the problems that we get when we get to be 30 and 40 and 50, what are the problems you have there? Do you get labrum tears then, or you start thinking about other problems?
Yeah, it's not as much labral pathology at that point. You can get those, but those are usually degenerative tears, kind of just getting a little bit older. What we typically see in our middle-aged patients is rotator cuff tears, because the rotator cuff tendon is there's 4 muscles that make up the rotator cuff tendon structure, if you will, and its job is to hold the ball in the socket.
So they let you move it around, but doesn't let the shoulder get out of the socket. That's the rotator cuff.
That's the rotator cuff. It essentially holds the ball in the socket so your bigger muscles can cause the shoulder to move. And over time, especially with more overhead activities, with more vigorous activities, those tendons can become torn, and specifically the ones up top.
So do they tear incompletely? Are they tears all the way through? Or you've got to get special x-rays, or your exam can tell you? How do you know how bad the tear is?
Many times it's your exam. And so for people listening out there, most of the time if you've got a significant rotator cuff tear, you've got a mechanical problem raising the arm, or you can't raise the arm at all. So some rotator cuff tears are large traumatic tears. You see people that fall down from an elevated position, they fall from a ladder. That's very frequent. The other thing is the repetitive stuff up overhead. So there's some specific occupations like mail carriers. You're always casing mail, doing stuff up top like that. They'll get partial rotator cuff tears that then get a little bit bigger, then get a little bigger. It's kind of like having a tear in your jeans, and you continue to wash it, and that tear gets a little bit bigger, and it gets a little bit more, it gets a little less distinct.